It is time on The Fan to check in with our injury analyst, Mr. Brian Seeney, better known on Twitter as @NRL Physio. Welcome again.
Good to see you, Bossy.
Quick quiz time. What is an ACL?
Anterior cruciate ligament.
What is a PCL?
Posterior cruciate ligament.
What is an MCL?
Medial collateral ligament.
What's an LCL?
Or the best one, lateral collateral ligament.
Ah, the old lateral collateral ligament. Never knew it existed. Now, can you differentiate between all four and explain where the worst of the damage can be done?
Absolutely. So we have our knee over here. So the ACL and the PCL, they are inside the knee joint itself, so in here.
Right.
The MCL and the LCL, they are on the outer edges of the knee, so the inside and the outside of the knee, so they are actually outside the knee joint itself.
So the cause of damage, it can, let's put it in rugby league context, if you hit from the outside of the leg as compared to not so common, hit from the inside or hit front on.
Absolutely. So obviously those ligaments, they stabilise the knee in different directions. So the most common knee injury in 2018 in the NRL was the MCL sprain, and that happens when the knee is contacted usually from the outside,
So
causing
your player standing in the tackle, hit on the outside,
Correct.
bang.
Collapses in. Now you often can see an MCL and an ACL injured together because when the knee collapses in, the ACL is also put under stress. Now your LCL, your PCL, they're a little less common because it usually involves a degree of hyperextension or even a bit of a collapse to the outside, which you don't see as often in tackles because of the direction most of your tacklers are actually coming from.
That's right, a defender not necessarily coming in from this side of the knee. And in commentary, when you hear us talk about, well, he's headed for a knee reconstruction, is major damage to all of those ligaments the next step, the knee reconstruction, or is it just the ACL and the PCL?
Yeah, look, usually in the NRL, when we're talking knee reconstructions, ACL reconstructions, you're usually looking at least an ACL rupture, but some combination of the other ligaments too. But if you have a complete rupture of an MCL, an LCL, or even a PCL, you'll find in the NRL they often won't require surgery as these injuries are able to be managed without that.
Very interesting. Never has a segment on TV involved so many MLs. Thank you for coming on NRL Physio. Follow
Pleasure.
him on Twitter.